Good morning. You're watching News for Hearing Impaired. I'm Preeti. With me is Meera. First, the headlines. People in India to light diyas, candles and torch for 9 minutes at 9 p.m. tonight together. Challenge the darkness spread by the corona crisis. Countrymen to switch off lights for 9 minutes in response to Prime Minister Narendra Modi's call. Indian Council of Medical Research issues advisory to start rapid antibody-based blood tests for COVID-19. Cases of influenza-like illness to be monitored in health facilities and any surge in cases to be brought to the notice of surveillance officer or the chief medical officer. Testing and treatment of COVID-19 is now available for free under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Prime Minister Narendra Modi holds telephonic conversation with presidents of United States and Brazil and Prime Minister of Spain in the wake of global COVID-19 situation. Prime Minister Modi discusses with the three world leaders the importance of international cooperation to fight the global health crisis. Prime Minister Narendra Modi chairs joint meeting of empowered groups constituted for planning and ensuring implementation of COVID-19 response activities across the country, reviews preparedness and directs officials to ensure sufficient production, procurement and availability of all essential medical equipment. %30% of total COVID-19 cases across the country linked to Tablighi Jamaat, with over 1,000 positive cases emanating from 17 states. Home Ministry says around 22,000 Tablighi Jamaat workers and their contacts quarantined. Active COVID-19 cases in India rise to 2,784 with 212 recoveries and 75 deaths. Power Ministry issues clarification on rumours of massive power grid failure due to turning off the lights at 9 p.m. for 9 minutes. Says no need to worry as adequate protocols are in place to handle variation in demand. Says there is no call to turn off street lights and home appliances. The nation will today join in Prime Minister Narendra Modi's call to switch off lights of their homes at 9 p.m. for 9 minutes and light up diyas, candles or mobile flashlights to display the nation's collective spirit to defeat coronavirus. In a video message earlier, the Prime Minister said that we will experience the superpower of light, clearly illuminating the common purpose we are all fighting for. He said, amidst the darkness spread by corona pandemic, we must continuously progress towards light and hope. He said that this is certainly the time of a lockdown and we most certainly are confined to our own homes, but none of us is alone. Prime Minister Modi added that the collective strength of 130 crore Indians is with each one of us and it is the strength of each one of us. Prime Minister Modi also said that the way people paid gratitude to those fighting against COVID-19 on 22nd of last month has become a model that is being emulated by other countries. He added that Janata curfew and ringing of bells have made people of the country aware of their unity amid this challenging time. Citizens are advised not to use alcohol-based sanitizers while lighting diyas and candles at 9 p.m. as it is inflammable. The Power Ministry has issued clarification on rumours of massive power grid failure due to turning off the lights at 9 p.m. for 9 minutes. The Power Ministry has clarified that the appeal by Prime Minister concerns voluntarily switching off lights only and there is no call to switch off either street lights or appliances like television, refrigerator, AC. Further, the centre has said that local bodies are advised to keep street lights on to avoid any law and order problems. The lights in hospitals and other essential services will remain on. The Power Ministry has assured that adequate protocols and arrangements are in place to handle the variation in demand when people switch off their lights at the same time. The Indian Council of Medical Research has issued an advisory to start rapid antibody-based blood test for COVID-19. The advisory states cases of influenza-like illness to be monitored in the health facilities. Any surge in cases to be brought to the notice of surveillance officer or the chief medical officer. It also said that chewing smokeless tobacco products like gutka, pan masala with tobacco, pan and other chewing tobacco products and areca nut, that is supari, increases the production of saliva, followed by a very strong urge to spit. ICMR has therefore issued a warning that spitting in public places could enhance the spread of COVID-19. To strengthen the country's response towards COVID-19 pandemic, the Government of India has decided to make testing and treatment for COVID-19 available under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. In a tweet, Union Health Minister Dr. Harshvardhan said that more than 50 crore poor and vulnerable citizens will be eligible for free COVID-19 testing and treatment under Ayushman Bharat. He also added that testing at private labs and treatment in designated hospitals has now been made free for Ayushman beneficiaries across the country. He also said that the private sector should act as a key partner in the fight against COVID-19 infection. Dr. Harshvardhan appealed to the private labs and hospitals to come forward in large numbers to become a part of this effort. Now, this decision comes with the objective to increase the supply of testing and treatment facilities and increase the access to them by roping in private sector through Ayushman Bharat scheme. Now, as per the ICMR guidelines for COVID-19 testing by private laboratories in India, the test is to be conducted by a laboratory which has NABL accreditation for real-time PCR assay for RNA virus. The laboratory test should be only offered when prescribed by a qualified physician for COVID-19 testing. Now, this decision will also help attract more private sector players for providing testing and treatment for COVID-19. Active private sector involvement will be critical in case there is a surge in the number of COVID-19 patients that need care. States are in the process of enlisting private sector hospitals that can be converted into COVID-19 only hospitals. And our correspondent Nitendu Singh talked to Ayushman Bharat CEO Indu Bhushan on the government's preparedness in the fight against COVID-19 in the country.
जो इस समय कोविड के मरीज हैं उनका टेस्टिंग और ट्रीटमेंट सरकारी अस्पतालों में हो रहा है और वो फ्री है। अभी हाल में आईसीएमआर ने प्राइवेट लैब्स को खोला है, तो ये जो निर्णय लिया गया है उसका उद्देश्य ये है कि जो टेस्टिंग है उसको थोड़ा बढ़ाया जाए। जहां पब्लिक सेक्टर है उसको बढ़ाएं और प्राइवेट सेक्टर को भी बढ़ाएं।
Also, Prime Minister Modi and US President Donald Trump on Saturday held a detailed discussion on the situation arising out of coronavirus outbreak and resolved to deploy full strength of the India-US partnership to fight the pandemic. The two leaders held an extensive telephonic conversation. Prime Minister Modi tweeted, and I quote him, "We had a good discussion and agreed to deploy full strength of the India-US partnership to fight COVID-19. The discussion comes at a time when both the countries are in the grip of the COVID-19 pandemic. The US has so far confirmed 278,458 cases of COVID-19 and more than 7,100 deaths. India has 3,072 coronavirus cases and has reported 75 deaths. Prime Minister also held a telephonic conversation with Brazilian President Jair Bolsonaro. Prime Minister tweeted, and I quote him, "Had a productive telephone conversation with President Jair Bolsonaro about how India and Brazil can join forces against COVID-19 pandemic." Prime Minister Narendra Modi discussed the situation arising out of coronavirus pandemic with his Spanish counterpart Pedro Sanchez yesterday. The two leaders agreed on the importance of international cooperation to fight the global health crisis. During the telephonic conversation, Prime Minister Modi conveyed his deepest condolences for the loss of lives in Spain and assured the Spanish Prime Minister that India would be ready to extend support to his country to the best of its ability. The two leaders also agreed on the importance of international cooperation for fighting the global health crisis. The Spanish Prime Minister agreed with Prime Minister Modi's observation that the world needed to define a new human-centric concept of globalization for the post-COVID era. The two leaders also said that their teams would remain in constant touch with each other as regards the evolving COVID-19 situation and the requirements emerging from it. Prime Minister Narendra Modi chaired a meeting of various empowered groups set up to respond to coronavirus threat and directed officials to ensure sufficient availability of all essential medical equipments such as personal protective equipments like masks, gloves and ventilators. In a series of tweets, the Prime Minister's office said that the Prime Minister reviewed the countrywide preparedness regarding availability of hospitals, proper isolation and quarantine facilities, as well as disease surveillance, testing and critical care training. Further, Prime Minister also directed the concerned groups and officials to ensure sufficient production, procurement and availability of all essential medical equipment such as the PPEs. 30% of the total COVID-19 cases across the country are linked to Tablighi Jamaat congregation in New Delhi last month, with 1,023 positive cases from 17 states, including Tamil Nadu, Delhi, Andhra Pradesh and Uttar Pradesh. Home Ministry yesterday said that through a massive effort, nearly 22,000 people linked to the religious grouping and their primary contacts are quarantined too. The total number of active COVID-19 cases in the country has risen to 2,784, while 212 persons have been cured. 75 deaths have been recorded till now. Meanwhile, a CRPF officer has tested positive for COVID-19. All personnel in contact with the officer have been quarantined. The DG CRPF had an indirect contact with the officer. As per protocol, the DG is observing quarantine. Meanwhile, as many as 108 doctors, nurses and other paramedical staff at Delhi's Gangaram Hospital have been put in quarantine after they came in contact with two patients who in their second test report were found positive for COVID-19. Of the 108, 85 are in home quarantine and 23 in the hospital. The Health Ministry has issued an advisory on the use of homemade protective cover for face and mouth. The ministry said that we are aware that social distancing and personal hygiene are the keys to prevent COVID-19 infections. Certain countries have claimed benefits of homemade face cover for the general public. Such homemade face cover is a good method for maintaining personal hygiene. Therefore, it is suggested that such people who are not suffering from medical conditions or having breathing difficulties may use the handmade reusable face cover, particularly when they step out of their houses. Homemade face cover is not recommended for either health workers or those working with or in contact with COVID-19 patients or are patients themselves. It is advised that 2 sets of such face covers be made so that one can be washed while the other is used. Such face covers should also not be thrown anywhere but kept safely, washed properly with soap and hot water and dried properly before they are used again. There must not be a sharing of face covers. The Indian Railways has clarified that it has not issued any restoration plan with train details and frequency of passenger trains. In a tweet, the Railways said certain media reports have come on a post-lockdown restoration plan with train details and frequency, etc. It is to clarify that no such plan regarding the resumption of passenger services has been issued. All concerned would be duly informed about any further decision in this regard. Ministry of Home Affairs has clarified on the ground level issues being faced by states in ensuring smooth flow of supply chain of essential items during national lockdown to fight COVID-19. States have been advised to brief district authorities and field agencies to avoid ambiguity at ground level production, warehousing and transport of essential goods such as food, groceries, fruits and vegetables, dairy and milk products are included under exceptions in the guidelines. Taking the case of laboratories, the communication clarifies that they have been exempted from lockdown restrictions. This includes the testing laboratories in the private sector for COVID-19 samples. Queries have also been received as to what constitutes food and grocery. States and union territories have been advised to interpret the terms to mean all items of food and grocery that are usually consumed by people on a day-to-day basis. Operations of railways, airports and seaports for cargo movement, relief and evacuation is allowed under the guidelines. Interstate and intrastate movement of all trucks and other goods and carrier vehicles with one driver and one additional person is allowed as long as the driver is carrying a valid driver's license. Air India is scheduled to operate 18 charter flights to fly back German, French, Irish and Canadian nationals stranded in India during the lockdown as requested by the embassies. Now, these chartered flights started from 31st of March with German nationals flying to Frankfurt. A charter cargo flight was also operated from Delhi to Shanghai yesterday to fly in vital medical cargo from China to India. Air India is also scheduled to operate some more cargo flights between Delhi and Shanghai till 9th of April. Now, these flights will bring critical medical equipment to India. The 21-day lockdown in the country is done to contain the spread of coronavirus. In such a situation, the service of dial 112 in Uttar Pradesh is proving effective to help the people. Now, this service is providing solutions 24/7 to people from food products to health-related problems. ADG in charge of emergency number 112, Asim Arun, said that people from all over the state use this service for any problem, are being provided immediate help. Chief Minister Yogi Adityanath has appealed to people to follow the guidelines of the lockdown. He said that people in large number are using this facility and calling on this emergency number. Help is being provided to patients to reach hospital and medicines are delivered. Yogi has appealed to people through the medium of Doordarshan to support the government in the fight against coronavirus and also follow the lockdown. Amid a countrywide lockdown due to COVID-19, Prime Minister Narendra Modi will interact with floor leaders of various political parties via a video link on April 8th. Prime Minister Modi will interact with floor leaders of all those political parties who have more than 5 MPs in both the Houses of Parliament on April 8th at 11 a.m. The video conference pertains to COVID-19 related issues. The death toll in Italy from COVID-19 has reached 15,362 with 1,24,632 cases of the virus. The worst hit country has recorded 681 new deaths in the past 24 hours. Total 20,996 people have recovered with 1,238 recoveries. Civil Protection Department Chief Angelo Borello confirmed that there were 2,886 new active coronavirus infections compared, bringing the nationwide total to 88,274 cases. In Spain, Prime Minister Pedro Sanchez announced the country's lockdown to be extended till April 25th in order to curb the spread of coronavirus. Spain on Saturday recorded a second successive daily fall in coronavirus-related deaths with 809 fatalities. However, the total number of fatalities in the country stands at 11,744, second only to Italy. Now, the number of new Spanish cases also slowed to 7,026, taking the total of infected to 1,24,736. Meanwhile, the recoveries over the last 24 hours stood at 3,706, taking that total to 34,219 so far. A nationwide 15-day state of emergency was first announced on March 14th, barring people from leaving home except for essential outings such as buying food or seeking medical care. U.S. President Donald Trump has warned the Americans of the toughest next 2 weeks as the number of confirmed coronavirus cases crossed 3 lakhs mark and the death toll stood over 8,000. He also urged media outlets to stop spreading false rumors on coronavirus. As on Saturday, nearly 90% of America's 330 million population were under stay-at-home order, and major disaster declaration was notified for more than 40 of the 50 states. Members of the White House task force on coronavirus have projected deaths between 1 lakh to 2 lakh people in the U.S. in the next 2 months. In France, a total of 441 people have died over the past 24 hours due to the pandemic COVID-19. The Health Ministry said that the tally is lower than the previous day high of 588. With this, the total deaths in France due to coronavirus outbreak has climbed to 7,560 and the number of cases mounted to 68,605, which is an increase of 6.6% as compared to the previous day. In the past 24 hours, 500 new cases of COVID-19 have been registered in the country, while 6,838 are in the ICU. Britain saw 20% rise in the fatalities as it recorded 708 new fatalities due to the pandemic COVID-19, taking the total death toll to cross the 4,310 mark. Britain is unlikely to lift its stringent lockdown rules until the end of May, as the tally of confirmed cases reached 42,000. The government has put Britain into a widespread shutdown, closing restaurants and nearly all shops, while ordering people to stay home unless absolutely essential to venture out. Dubai has announced complete lockdown for 2 weeks in view of the round-the-clock sterilization program to combat the spread of COVID-19. Extensive medical tests will be conducted across the densely populated areas to ensure members of the community are not affected by COVID-19. Dubai's Supreme Committee of Crisis and Disaster Management also warned that strict legal action will be taken against any violators. Members of the public are allowed to go out for essential needs such as buying food. However, only one family member is permitted to leave the house for this purpose. The vital sectors, however, have been exempted from these restrictions. Earlier, UAE had announced the continuation of the National Disinfection Program as part of the preventive and precautionary measures to contain COVID-19 during 8 p.m. and 6 a.m. Meanwhile, the UAE Health Ministry on Saturday confirmed 241 new cases of COVID-19 in the country. The total number of infected cases has now increased to 1,505. A total number of 125 cases have also recovered from the infection. Hitting out at Pakistan Prime Minister Imran Khan on his comments on Jammu Kashmir's new domicile law, Ministry of External Affairs has said, and I quote, "We have seen the intemperate remarks by Pakistan Prime Minister Imran Khan on India. With regard to the Indian Union territory of Jammu and Kashmir, it is very clear that Pakistan has no locus standi whatsoever on any aspect pertaining to it. Repeated attempts to interfere in India's internal affairs will not make its untenable claims any more acceptable. If Pakistan really wants to contribute to the welfare of the people of Jammu and Kashmir, it could do so best by ending cross-border terrorism and desisting from its campaign of violence and false propaganda." That's it in this edition of the news this hour. Thanks for watching. Namaskar.